people are working after reaching the age of 65 because Social Security rules have changed and the full retirement age has increased beyond 65. That's creating a whole bunch of complications for people. A whole bunch. And it's going to get worse. I'm Jay. I'm the author of Maximize Your Medicare. The 2019 edition is available. You can see information about the book. There's the website up there. Yes, there you go. www.maximizeyourmedicare.com. Let's take a quick look here. Yep, that's the web page for the book itself. You can see a bunch of different information. There's a podcast. You can see the videos, and you can ask me your questions down here. Is a free newsletter. Be sure to subscribe to it. It comes out to you directly into your inbox. I try to create it, and just because some things people want to read, some people want to not watch a video, they have to read it and read it multiple times because the topic's complicated. Sorry, it is complicated, but that is the world that we live in now, and we have to deal with it, and I'm trying to help you deal with it. So anyway, what I thought I'd do is go through the newsletter that just got released this past yesterday, and talking about the age of 65. So, under Social Security rules, most people do now understand that full retirement age is no longer 65 years old, right? Eventually, it will become 67, and it's increasing incrementally, etc., etc. There's all sorts of YouTube videos about when the optimal time to claim, delayed credits, that type of thing, restricted application, spousal benefits, etc. When's the right time? And today isn't really about that, even though I can give you those opinions on what I think about it for your individual situation, which should vary compared to the boilerplate solution. This should be individualized because it does come down to your health, right? Because that affects all of your timeline as far as making financial decisions in the future. Okay, I'll get back to the newsletter here. So at any rate, the base case is that you know it. It's obvious. I don't need a study, right, to prove this point. The fact is that people are working beyond 65. Whether they're doing so because they want to stay engaged in their job, whether or not they're doing so for financial necessity, Jay does not care what your reasoning is. The reality is this does affect the Medicare enrollment process, and it's becoming harder. So let's take a quick look through my points here. So yes, people are working beyond 65, long list of reasons. Yes, that's clear. The issue here is that when you work beyond 65, you are inviting the idea of late enrollment penalties, right? There's late enrollment penalty for Part B. There's late enrollment penalty for Part D, okay, which is the prescription coverage. So for Part B, that is services. You can see my upside down Medicare card up here, so you can see it. Medical, that's Part B. And then there's Part D, which is not part of this card, which is prescription drug coverage. And you can see the other videos on how to select. Our firm guides people in terms of finding them the efficient solution to minimize their out-of-pocket costs. Now, the fact is that there are different penalties for both. And the fact is that what ends up happening is that you need to be able to prove to two separate entities that you have had health insurance coverage and you've had prescription coverage. And those two are separate. Okay, under Medicare, those are handled separately. So people may be interested in, for example, in Medigap and Part D. Well, those could be two different sellers. You've got to provide them separate pieces of evidence whose evidence is actually slightly different to say that you have had health insurance coverage. What this really means is that you've got to prove that you've had health insurance coverage with less than an 8-month break. Okay? So people say, okay, well, I'm perfectly healthy and I've worked beyond 65 and then I've stopped working at 67. I don't need health insurance because I'm healthy and I get an 8-month break. So they end up stopping their health insurance. Fine. You can only do so for 8 months. COBRA, even though it lasts, we'll get to COBRA in a few minutes. Actually, I've jumped the gun. Okay. The thing is that you can only have a prescription coverage break for 63 days. So while you may have retired at 67 and then you cancel your health insurance, which included prescription drug coverage, that's fine for the health part because that you have an 8-month window. However, the prescription portion is running out. You can only have this break for 63 days. Gotta be careful. So you have 2 different deadlines, not just 1, 2. Okay? And that's this point of point C, which is here. There are different windows or deadlines for health and prescription drug coverage in effect when you retire after 65 years old. Keeping these details is not easy. Now, the shortcut here is don't allow a break, right? Because having a break, you're introducing Murphy's Law, of course. But again, you may have your own personal reasons, financial, or you don't like insurance. Whatever your reasons are, I'm not questioning that. But the complication here, the point of this article here, the point of my article here in this newsletter is the fact that there are 2 different ones, and you have to keep track of them both. Now, COBRA also introduces a twist here. The reality is I could create an entirely different video about COBRA. So COBRA for persons who have been terminated for whatever reason after a particular point in time after working at large employers, okay? And by large employers, that means anyone with over 20 full-time enrollees in this instance, okay? You're entitled to COBRA. You're entitled to COBRA for 18 months, okay? Generally speaking, COBRA is very, very expensive. You would have to give me some very good evidence and reasoning for why you'd want to continue on with COBRA coverage. Does it exist? It does exist. I don't want to say as a blanket statement, hey, you should always cancel COBRA. I can't make that point. There are reasons. For example, you're really close to the out-of-pocket maximum. You've got a spouse and child that you need to consider between now and then for some period, and you need to think through it. So there can be reasons, and there are 2 very easy ones right off the top of my head. So I'm not in the extreme camp on almost anything because the different situations are so different that you can't just make blanket statements and say, okay, we should always cancel COBRA. That's too extreme. That said, it's costly. Okay, it's very costly. And you know this because then the full sticker price of health insurance at large employers is revealed to you, right? Because you have to pay the whole amount. You may be charged an administrative charge. That is the right of your ex-employer to charge you more than the actual premium involved. Excuse me. So, COBRA can last for 18 months. That's true. That is true. The problem is the Part B enrollment deadline is after 8 months. So now you're gliding on COBRA. Let's say it's the best case scenario. Your employer is paying the entirety of COBRA for you. Okay, I've seen this. Okay, is it common? No, it is not. But I've seen it. COBRA can last for 18 months, but that does not count for the Medicare Part B enrollment penalty. Oops. You get to the 9-month, and then the Part B late enrollment penalty starts to apply first. Second, not only that, but you have to wait until the Medicare open enrollment period, which begins on January 1st, the next future January 1st. Okay, so now let's just say you've glided along on COBRA until February. And then you go, oh, I'm trying to avoid my late enrollment penalty. My Part B, late enrollment. So you've waited for 8 months and it ends in February. Do you get to enroll and then for me to be, I'm sorry, let's say that the COBRA ended in April. You don't get to start up in May. That does not occur. And even in the February case, you then can enroll between January and March 31st, but your coverage date doesn't start until July, the next July. So you can see what ends up happening. People say, okay, well, Jay, I've been covered by COBRA, so I've had health insurance, there's no break. How long have you been covered? I've been covered by 12 months, and it's now February. I say, fine, you can enroll in February, but then you're going to continue on, and your coverage doesn't start until the coming July. Scary stuff here. Point E, retiree health plans will continue to weaken. Now, this is kind of known, right? This is not a surprise to people anywhere. In the state of Texas, 40,000 teachers canceled their retiree health benefits because they had weakened to such a degree, and the private market was superior. Now, it's the result of financial pressures from a large number of sources. Fiscal and demographic reality facing state and local governments. We know this. City of Chicago, City of Detroit, many other communities, townships, states, teachers. The retiree health benefit system is eroding. It's eroding because they simply can't afford the huge number of retirees and the fewer number of active employees. Now, I'm not going to settle here today the company should have, or they owe this, and stuff like that, right? That is a political or ideological, philosophical debate. I'm just a person, I'm just a guy, right? And I'm not here to settle that debate for you, right? What I am here to do is try to make sure that you are aware that this stuff is going on. Now, this one's more subtle. Point F is more subtle, which is that if you're working beyond the age of 65, what isn't well known to many, and especially to people who just never look, is the fact that even if an active employee, overall health care costs incurred via employer health insurance plan can very easily be much higher with weaker benefits when compared to Medicare. True. So let's take a large employer and you are charged $450 a month. Well, Medicare costs you $135, supplement if you're 65, 66, depending on your location, can be in the low 100s a month. Part D, the national average for 2020 has already been released, will be about $30 a month. Okay, so now you're talking about 135 plus 120, let's call it. That's 255 plus 30, 285. Compare this to 400, 500 a month. Okay, so $1,000 immediately in premium. It's not only that, it is that the coverage, high deductibles under employer-sponsored plan. You've seen it, $2,500 for an individual, $5,000 for a family, $10,000 for a family, for example. This stuff is going on today. I'm not going to show you the slides today of all the think tank slides that are telling you that people, even on employer-sponsored coverage, are suffering. Yeah, that is the case. But the reality is that this could have been avoided. This could have been avoided even if you're an active employee. Now, you could say that, yeah, well, the employer is paying. And so my premiums are very similar. While the premiums could be similar, as soon as you require the healthcare coverage, Medicare is very likely to be superior in terms of the deductibles, the copay, the co-insurance, the out-of-pocket maximum. Those fine details of health insurance are superior under Medicare in the overwhelming number of cases. Now again, the tricky thing about what I do is, just like in the COBRA instance, I don't get to say in every instance. That cannot be true, right? There's a reason that people like me get calls by people around the country, right? Because their particular situation, they're just trying to make sure they haven't missed something. Just need to make sure. You have a Medicare eligible, you may or may not have a Medicare eligible spouse. You may or may not have an adult age child, 26-year-old child that you need to cover under your plan. Yeah, but you may live in a state where you can get the Affordable Care Act plus a tax subsidy, which would lower your overall premium. Hard to say. Can't make that conclusion, certainly not on a 20-minute or 30-minute video that we're going to have here today, right? We cannot make blanket statements here. There's no shortcut to flipping over the rocks and examining your particular situation here. I'd love to make it easy for you. I'd love to just say, okay, well, there are no complicating factors. We know life is different than that. Okay. And I alluded to it here a couple of times already. So married couples have a specifically different issue. And for example, now you're on your employer-sponsored plan or your retiree plan. Well, the retiree plan may also allow you to access benefits for your non-Medicare eligible spouse. Now you've got to put pen to paper. You can remember I told you up here in Part F, right? I saved you the $100 a month, $200, and it can be more than that. I was understating it intentionally, right? It can be more. That $100, does it have to be reallocated to the spouse? That can be the case. It may not be. You may be charged the entire amount for the spouse, which would be, $600. Well, you save the $100 and you go and find the Affordable Care Act plan and use it to cover your non-Medicare spouse. That is something we do all the time. We go and identify it, compare it so that the consumer, you're able to choose what's efficient for you. Because look, let's just say, for example, you're the retiree and you have a truckload of medical bills because you lost the DNA coin flip. Okay? You have some situation, you have some health situation. Maybe within your control, maybe beyond your control. I'm not here to judge that, right? Or determine any of that. But let's say you have a long list of bills. Well, under your employer-sponsored plan, which we've already said is largely weaker than under Medicare, the savings under Medicare can make up for the entire difference in the higher premium for the spouse. That can be the case. That can easily be the case. Point F, and this is fairly new. And this is coming up more and more. And even just this past week, 3 cases, all the same. So what's happening at employers, right, is, and it can be small employer or large employer, there is a movement towards high deductible health insurance. The deductible is very high, $10,000 for a family. But then you're allowed to create a special bank account called an HSA, health savings account, right? And the monies you deposit in there can be used on a pre-tax basis to cover your health costs, not health insurance premium, but for example, prescriptions, office visits. It can cover dental costs, for example. The problem is that when you retire after the age of 65, let's say you're now 66. You've turned 66, You say, okay, I'm going to retire now. The problem, or let's say you've never enrolled in Part A to begin with, and when you turn 65, that is also a case. You now retire when you're 66, or you enroll in Medicare Part A at 66 years old. The issue is the Part A coverage date gets backdated by 6 months. And I know this is upside down, so you can either turn your computer upside down or you can read upside down. Anyway, let's say that medical here for this person, John Smith, this person turned 66 in March, so he'd be turned on his Part B. This date here would not read March of 2016. It would read September of 2015. So why am I making such a big deal of this? The reason is, since it's backdated by 6 months, cause problems if you have contributed to an HSA, that special bank account, pre-tax bank account that I just mentioned. What happens is, since you can't simultaneously be receiving Part A benefits and contribute to your HSA, doing both at the same time is a tax violation. Contact your accountant. Okay, so now John Smith has realized this in March. Guess what? He's already contributed in 2015 in this case. Because this date is September of 2015. And he's contributed. Is that right? Yeah. September of 15. So yes, he has actually contributed to his HSA. We got a problem here. Right? One that I don't know what the solution is, but the point here is that it is tricky. Your bottom line advice, and I get asked this a lot. Jay, when is the first time, when do I got to reach out to you when I'm thinking about Medicare planning? And I tell even the procrastinators, reach out a year prior to considering retirement or a year prior to turning 65, whichever is earlier. Because these complications here, these ripple effects, it's too difficult for everyday people and even highly researched people, right? Highly qualified, even we've got people with public health educational backgrounds and healthcare consulting backgrounds, hospital CEO backgrounds. That exists here amongst us. Financial advisors are amongst our clients. These complications, and the issue here is that any one of these by itself is enough to create unwanted financial cost. So either you're paying too much premium, or you're getting weaker than optimal benefits, or both. I've introduced a new one, here point H, tax penalty. This is a multiple $1,000 a year issue if not handled early and correctly. I'm trying to keep you on the right track to try to avoid all of this. Don't forget, MaximizeYourMedicare.com. That's the website to the book right there, MaximizeYourMedicare.com. Can't miss the title of the website itself. Also, I'll shrink my big head over here. This Facebook community, Maximize Your Medicare Community. Go up into your search bar, type this in, Maximize Your Medicare Community. You need to actually apply. This is a closed group, as you can see, closed group. Anyway, I'm going to accept you. That's not the problem. The number of headlines here is crazy. Okay? And it's going to get worse here, especially because it's our wonderful political season, and you can see my other videos where I'm making comments about what I think about these different plans and trying to explain it to you in language that you can actually understand. and not be necessarily engulfed in the pot shots and the arrow shooting, the mudslinging that we're going to see. And we're just getting started. So anyway, in here are updates. You can see my friend Josh Scanlon here, a fellow certified financial planner, good enough to post to YouTube, give me props on the newsletter itself about Medigap changes in 2020. My comments about think tank stuff. This is kind of important actually here. So I don't question the academic background of these people in here. It would be like lunacy for me to do so, right? Let's see if we can blow up one of these. I think we can. Yeah. So right here is, a think tank set of alarming statistics. And this Kaiser, this is the highest tier of think tanks. The highest tier in our country, okay? And you can see some alarming numbers here. Yeah, but this doesn't really tell you about what your out-of-pocket cost it actually is for people under Medicare. There are ways to deal with this. For example, if you have infusion, this can be covered by Part B plus a copayment, or if you have a Medigap, covered in its entirety. Depending on the plan you have much lower copays. Beyond catastrophic coverage, you only pay 5%. So in other words, these aren't inaccurate, they're not wrong. But what the group is doing is basically saying, look, there's a lot of noise in the world. A lot. And some is used by politicians, elected officials, or wannabes, if you will, where they're trying to raise alarm and concern of the population, hysteria. Yeah, I'm not really in that camp. Right now, that doesn't mean that you should mishandle or neglect it. That I didn't say that, right? I'm the last person to suggest that you just, set it and forget it. That also doesn't work. But anyway, inside this community are my comments about what you're seeing in the media, all the information, the avalanche, the blizzard of information that everyone's getting, and trying to make heads or tails of it. I'm Jay. Be sure to subscribe to this new YouTube channel, and be sure to go to MaximizeYourMedicare.com and sign up for this Facebook group. Talk to you later.